Hello everybody, today's blog is going to be about unexplained chronic cough. So I see a fair number of patients referred to me for this problem. So common reasons for chronic cough are things like asthma, allergies, smoking, or acid reflux. And all of these can irritate the throat or the lungs and cause chronic coughing. A lot of times, though, I'm seeing patients in my office who have already been treated for all of those common things, or at least told to quit smoking, and they're still having chronic cough. So a common problem that I'm able to find and treat in my patients is something called neurogenic cough. So what is this problem? So neurogenic cough is a problem with the nerves to the throat and the voice box. So typically the story is someone had a bad cold or a viral infection at some point in the past. That could be a few months ago. It could even be many, many years in the past. And after that viral infection, they've just had this persistent cough. Frequently it's a dry cough, and it kind of hits them in coughing fits or attacks, where they're just coughing and coughing and coughing for a few minutes straight before it kind of peters out. So the idea is that the viral infection that they had caused inflammation in the nerves to their throat. And once they recover from the infection, the nerves remain inflamed and bothered. And it just kind of sets up this cycle where they're coughing all the time. Certain things are triggering their cough to happen all the time. So commonly, the triggers for this problem are things like talking a lot. So commonly I'll ask somebody, if you got on the phone with a friend for 30 minutes or an hour, would you be coughing more and more by the end of the phone conversation? Another common trigger would be sudden temperature changes to the throat. So if you suddenly took a big drink of ice cold water, would that trigger a coughing fit? And also things like chemical odors or smoke or sort of strange odors. Sometimes those things can trigger coughing spells. So this is sort of the typical story we see. So how is neurogenic cough treated? So it's usually something that can be treated effectively with medications. All of the medications for this problem were originally used to treat other problems. So some medicines are antidepressants originally. Some of the medications are actually opioids, one called tramadol in particular. And some of the medicines were originally anti-seizure medications. So normally the one I would start with is an older antidepressant called nortriptyline. And it's something that in most of my patients is pretty well tolerated without a lot of side effects. And in fact, people usually will take it at bedtime because it makes you a little drowsy, and it'll actually help them to fall asleep. And I've had a lot of success treating this problem with these kind of medicines. So if you're someone who's had coughing fits for many years and you're tired of it, come and see me, and I can probably help you.